Hi, once again, good afternoon, everyone. So my name is Dawn, your NC for this afternoon session. So first of all, I would like to thank EVG Global Network and my upline for introducing Elite Career into my life. So I would also like to thank all of you for taking your time to join us this afternoon to explore into the differences between medicine, supplement, and food. So before we begin, I believe that our AV team has put your Zoom on mute to allow the session to run smoothly without interruption. So later on, we will have a Q&A session. So if you have any question, you can unmute to voice your questions. But of course, if you do not wish to on the mic, you may use the chat function to type in your questions too. So later on, picture will also be displayed during the presentation. So if you can't see clearly, you may zoom in for a clearer view. Thank you so much. Yeah, so as the technology has advanced, so there are more and more types of medicine invented by pharmaceutical scientists, and also we can see the increasing number of people believe in medicine science, some believe in traditional Chinese medicine, and some believe in supplement. So there are actually a wide range of health food in the market saying that they are good. But how can we ensure that our choice of health investment is value and more secure? So today we will have Melody and Jia En to cover today's topic. So the first part will be shared by Melody. So let's welcome Melody.
Hello everyone, a very good afternoon to you. So I'm Melody, right? Please hold on while I share my screen with you. Okay, so first of all, let's have a better understanding on medicine, right? So how does this medicine actually comes about? Okay, before I start, I would like to thank EVG Network as well as my upline, right? So, back to the 19th centuries, scientists actually realized that, a lot of women, they actually died of unknown reasons during their child delivery, right? So it's until then that they discovered that, it's because doctors, they did not wash their hands at all when they are delivering the baby. And that's why it caused the women to have a bacterial infection and resulted in their death, right? So that comes about the invention of the first antibiotics, the penicillin. It was first developed in 1928, and it's only until 1942 when it is being put in use, right? So when we talk about like antibiotics, of course, we have to use it properly. Like say, for example, in the States, in the US, tests must be performed, on the patient first to make sure that, you really have the bacterial infection. Then the doctor will give you the necessary antibiotics. But you see, this kind of practice, right, is not common in Asia countries, not in Singapore, probably not in Malaysia as well, right? So which means that if, let's say, we do not have we are not affected by the bacteria, but we are still eating the antibiotics. That is a form of a drug misuse, right? So generally, a typical drug, antibiotics is actually being prescribed to treat many forms of bacteria. So in high dosage, it will actually hurt the liver, it will hurt the kidney, right? And however, if let's say the dosage of the antibiotics is far too low, that means that it can't actually kill the bacteria, and the bacteria will continue to grow, to continue to flourish. So as the body gets used to it, the same antibiotics will not have any more effects on our body, which means that we are, resistant to that drug. And that caused another concern, which is the rise of superbug. So in most cases, right, diseases are actually not caused by bacteria, but rather by viruses. So let's take a look at the common viral infection, such as like the SARS, H1N1, influenza A or B, Hep B, hand, foot, mouth disease, Ebola, dengue fever, or even like the Zika viruses. So some of these viruses, yes, they do have vaccines for some of them, not all, right? So let's have an idea, like, how vaccines is being formed. Okay, so let's take a look at this picture. So supposedly today, right, if let's say a virus or a bacteria enter into our body, then the B cells in our body, they will start to react. They will start to produce different antibodies so as to counter against the viruses, bacteria, any other form of like pathogens, right? And then they will also have a memory function. So that if let's say, next time, if let's say we were to caught the same viruses and bacteria again, then yes, the B cells will even be more efficient to destroy all these viruses as well as the bacteria. Okay, so using a similar concept, what scientists do is that scientists extract the weakened viruses, the dead viruses, or even like the bacteria from the infected patient. They take out the viruses and then they put it together in a vaccines, and then they will inject these vaccines into the people, right? So that these people can actually develop the antibodies against this bacteria and viruses, right? So this is how the vaccines work. But you see, there's so many viruses, and there will be more to come as well. But there is no way that vaccines can actually catch up with the rate of, the viruses, the mutations at all, right? So it is still best to still rely back on our B cells to do the job for us. Next, okay, the drugs for autoimmune. So some of the autoimmune diseases that you might have heard of would include rheumatoid arthritis, or even like lupus or the Sjögren's syndrome. Right? So these are the some of the common ones. So typically, right, for autoimmune diseases, steroid will be prescribed so as to suppress the immune system. But it also comes with side effect, because it actually increases the severity and vulnerability of these patients to infection, and therefore it also increases the risk of them getting cancer. So generally, it weakens their general immunity. And how about for drugs like, hypertension, cholesterol, all this, they are known as the chronic disease, the long-term disease. So say, for example, today, if let's say I have high blood pressure, then the doctor will, of course, give me like high blood pressure or hypertension medication. If let's say I have high cholesterol, then I'll be given like a cholesterol medication, and so on. But you see that they actually only reduce the symptoms, because if let's say I were to take the medication today, then I'll be good. But if let's say I forgot to take, then you'll see that the medical condition actually come up again. So basically, there's no cure, because such medications are only treating the symptoms. So other common drugs would include maybe like fever medication. Of course, that's to stop the fever, stop the pain. But at the same time, it will also cause the liver and kidney failure, the damage of them. And in severe cases, even like the brain damage as well. And like the one that we've talked about earlier, the antibiotics, yes, it does kill bacteria, it treats the bacterial infection, but at the same time, it also causes the bacteria resistance, it causes side effects such as like the diarrhea, the yeast infection, or even like the seizure. Sedative is commonly being prescribed, to help people to relax, but again, it comes with some side effects such as the short-term memory loss, addition to the kind of medications, or even resistant to the medications after a month. Or even like, commonly, if let's say we feel pain, joint pain, headache, commonly people will actually reach out for painkillers so as to, make them feel a bit better, relieve the pain. But do you know that they can actually cause the bleeding in the stomach, or even slow down the wound healing? Right? It can actually cause like liver damage as well, and in like severe cases, vomiting, hallucinations, and even like the blurred vision. So modern medicine, widely, it can be categorized into two types. The one that we have talked about earlier in terms of the medication, and in severe cases, we might actually need to go for like surgical procedures to help us to feel better. So basically, drugs, medications, they can actually save life in times of emergency. But however, if it is misused, it can kill. So let's take a look at a short video by Dr. Chen Zhaofei, who has the authority in preventive science and is also the founder of nutritional immunology. Let's take a look at what she says about medication.
Drugs cannot guarantee a cure. Drugs also give harmful side effects. Sometimes the side effect can be worse than the disease itself. Recently, it was reported that up to 98,000 people die annually from mistakes made in US hospitals. Many of these mistakes were wrong drug prescriptions. We must know that many diseases today don't have a cure. For example, SARS killed 900 people in 2003. Bird flu kills 3 in every 10 people infected. Why isn't there a cure for SARS or bird flu? SARS and bird flu viruses are mutated viruses. It is very difficult to find a drug that kills them. If a drug is found, when the virus mutates again, the drug might become useless. Even the common flu has no cure. Every year, up to 500,000 people die from flu. Flu drugs don't kill the flu virus. The drug only shortens symptoms by a day or 2. Think about the time you had a cold and a headache. The painkiller you took did not kill the virus, but still, you got better. How? During the SARS outbreak, some people died during treatment. Others on the same treatment survived. Some cancer patients live for years, although doctors tell them their days are numbered. How is this possible? It is not magic. It's not because of drugs. It is because of the person's immune system. The good news is that all of us have an immune system. In fact, with a little bit of help, we can use our immune system to prevent almost any disease in the world.
Right, so hopefully through this very short video, you will have a better understanding on what medication is. And then without further ado, let's move on. To talk about supplements, so something that's not so alien to us, right? So how does the supplement actually comes about? Do you know that during the World War, there was actually a famine outbreak? People are dying of starvations and falling ill because they lack the basic nutrients for survival. So basically, the first supplement comes about so as to help these people to survive. And the common vitamin pills that are found in the market, right? That includes vitamin pills such as the vitamin A, vitamin C, vitamin D, or even like vitamin E. So let's take a look at these vitamins. Do you know that like vitamin A's, they come with side effects as well, such as causing fatigue, osteoporosis, or even like the birth defect and lung cancer, or even like the common ones that majority of the people are taking, right? Vitamin C supplements. They can actually cause kidney stones as well as cancer. Vitamin D can cause the fast heartbeat as well as irregular the heart rates. And vitamin E can cause osteoporosis as well as prostate cancer. How about in terms of like minerals intake coming from a supplement, such as like the calcium? And according to a report that's being published by the BMJ, they actually conduct a trial among this like 12,000 participants, and they realized that taking calcium supplements can actually increase the risk of myocardial infarction, which is heart attack, by 30%. So that's quite a high percentage, right? Or even like minerals such as like the folic acid. A lot of women are taking, especially like women who are pregnant, right? They actually comes with side effects such as causing lung cancer, colorectal cancer, or even like the prostate cancer. So how about like the iron supplements? For those that are low in iron, sometimes they will take. Do you know that it can actually cause constipation, nausea, vomiting, diarrhea, or even affect our cardiovasculars as well? So glucosamine is commonly taken by those who have like joint pains or even like runners, right? So let's take a look at what are the common sources of where this glucosamine comes from. It can actually comes from the animals' cartilages, such as the bone, the shark, or they can also come from the shell of the shellfish, like the crab, the lobster, or they can actually be man-made in the laboratory as well. Okay, so some of the common side effects would include breathing difficulties or worsening the asthma. And if let's say the source of the glucosamine actually comes from the shell of the shellfish, these sea creatures, right, when they detox, they will actually accumulate their toxic outside their shell. So if let's say we are taking the supplement, it means that we are taking in the toxic as well, right? And that is also harmful to the human body. At the same time, taking glucosamine from these sources will actually cause insulin resistance and hence for increasing the risk of us getting diabetes. So next, omega-3 fatty acids from animal sources. Common sources will include like fish oil, fish skin oil, or even like the cod liver oil supplements. So some of the side effects will include increasing the risk of getting cardiovascular diseases. And since the sea is getting so polluted, where else to getting our sources from the sea? And do you know that eating all this like fish oil, the cod liver oil, they can also interfere with the effect of some common medications such as like aspirins or even like the blood pressure medication, right? And it also causes things like diarrhea, indigestion, even like abdomen bloating, nauseous, and even rash. So another common type of supplements, which is probiotics, it is commonly found in dietary supplements and in dairy products, right? So it can actually cause side effects such as like allergic reactions. Example would include breathing difficulties, having hive, vomiting, diarrhea, or even like coughing. So the young, the elderly, and those with weakened immune system should seek advice from a healthcare provider before using antibiotics, before using probiotics, because they can actually induce potentially fatal condition. So basically, this alternative medicine, they do have hidden dangers. So what exactly is the hidden dangers that we should be aware and be concerned of? That is, do you know that even like a little bit, just a slight overdose of supplement above the body tolerable limit can actually have adverse side effect on the body? Right? Say for example, today, if let's say I'm a pregnant lady and I take a vitamin A supplement, do you know that it can actually cause the baby to be deformed? But if let's say today I were to take carrot which is rich in beta carotene, then my body will be able to convert this beta carotene into the necessary vitamin A without side effects. Or say for another common example is, vitamin C supplements, right, can never be compared to that of an orange, because you see, vitamin C supplements, they are actually extracted, they are concentrated, right? And but when we talk about like orange, it's not only loaded with vitamin C, it's also loaded with fiber, with potassium, and with many more minerals, right? Today scientists have not actually discovered them all, but basically it is complete, right? So you see that we can take as many oranges as we like, but we cannot actually take as many vitamin C as we like, right? So it's similar to the concept. It's like today, if let's say we are able to walk, able to jump, but if we are given a wheelchair to sit on today, a few years later, what happens? The muscles will actually degenerate, and that will actually cause us to be not able to walk anymore. We are reliant on the wheelchair already, right? So it's the same kind of theory. So basically what happens is that, hidden dangers, because supplements, they are not wholesome, they are extracted and being chemically processed into a pill. That makes them to be too pure, too concentrated, and it can easily lead to overdose, right? And an overdosage can lead to some other complications, such as being reliant on the supplements, and at the same time, it also burdens the body, causing kidney and even like the liver failure. So basically, that is why you would hear people say that supplements, they cannot be consumed daily. So let's take a look at another video by Dr. Chen as well on her views on supplement.
Some people ask me, can you get all of these nutrients from a vitamin bottle? In order to be effective and well absorbed by the body, These nutrients must be obtained from wholesome plant foods. Yes, you might get antioxidant and multivitamins, but these are not natural antioxidants. They might have been extracted from plants, but isolating them makes them a chemical or a drug. Such chemicals can give toxic side effects. For example, beta-carotene or vitamin A is an antioxidant found in carrots. A study in Finland showed that smokers who took beta-carotene pills had more risk for lung cancer than smokers who didn't. But then, when we eat lots of carrots, we don't experience such toxic side effects.
Right? So hopefully the short video has also given you some insights on supplements. And of course, the reason why we're here today, we wanted to know how to improve our health, to get better. So we know that medicine is probably not a very wise choice unless it's being used during emergency. Supplements, probably not as well. So is there any other alternative that we can go for? So let's have Jia An to share with us more about the food.
Thank you, Melody. So first of all, I'd like to thank EVG Network and my upline. So I am Jia En, so I'll be sharing this topic on food. So hold on a moment while I share my screen. So I will be sharing this topic on food. So let's take a look. So take a look at this slide. So are humans meant to eat meat or plants? So we have a clue over here. So taking a look at the pictures. So taking a look at our teeth structures. Does our teeth look more similar to a lion or more similar to a horse? So let's take a look together at the teeth structures between herbivores and carnivores. Herbivores are plant-eating animals like the horse, have sharp front teeth to chew the plants and grass, while for carnivore, the front and canine teeth are sharp to tear meat apart. How about their intestine? So taking for example, a herbivore, which is about 5 feet long, will have an intestine about 60 feet long. While for carnivore, it will be 15 feet. So what is the reason for their differences? So plant-eating animals have longer intestine to allow enough time for absorption of nutrients, as plant food needs more time to be broken down due to the large amount of fiber. And carnivores have shorter intestinal tract to allow meat to pass through quickly, as raw meat actually have high number of bacteria. So after analyzing this table, right, research have shown that humans are evolved around 250,000 years ago from ape-like ancestors. So it turns out that humans are actually herbivores. So it is recommended for us to eat more fruits and vegetables. So talking about plant foods, not all plant food is safe for consumption, as plant food are categorized into these 3 categories: poisonous, medicinal, and functional. So the first one will be poisonous. So example will be ephedra, marijuana, and tobacco. Many diet pills actually contains ephedra, but as it is poisonous, it is actually not suitable for our consumption, as it burdens the liver and the kidney. And these poisonous plants can be fatal as well. So the next one would be medicinal. These are commonly found in traditional Chinese medicines, and with medicines, it comes with side effects. And overdosage can actually lead to serious side effects as well. And many Western medicines are also extracted from these Chinese medicines. So example would be aspirin, type of painkiller. It is extracted from white willow bark, which can cause stomach bleeding. And another example would be digoxin, a drug for irregular heartbeat. This is extracted from digitalis, which can cause heart disease. And these medicinal plants are actually not suitable for pregnant women and children consumption. The third one will be functional plant foods, which are wholesome plant foods like vegetables, fruits, and whole grains. These are foods suitable for all ages. No matter how much I consume it, there will be no side effects. So now I'll be sharing on the various nutrients in food first. So the first one will be protein, which is essential for our body cell renewal. So normally, where do we get our protein from? From milk, from eggs, from meat, right? All these are actually animal proteins, which are high in fats, cholesterol, animal hormones, and also calories. it actually increases the risk of osteoporosis, and it is difficult to digest and absorb by our body. And children who grow up drinking milk actually gets allergy more easily. It also burdens and damages the liver and kidney as well. And babies need protein too. So the first choice will be breast milk. If not, the second choice will be soy milk. Soy milk is actually free of fats, cholesterol, animal hormones, and also low in calories. It is also easily digested and absorbed by our body, so it does not burden our health. So in plant food, we say that soy is actually the best source of plant protein. It has 2 times more the protein than meat, 3 times more than egg, and 12 times more than milk. Soy actually has anti-cancer effect as it inhibits the growth of cancer cells and tumors. Soy also helps to prevent cardiovascular diseases, which reduces cholesterol and also prevents osteoporosis by enhancing calcium absorption and retention. It also stabilizes blood sugar levels as soy has a low GI index of 18. Soy is actually a good choice if you want to maintain body shape, as it also helps in weight management and speed up fat decomposition and inhibit body fat formation. So next will be fiber. Do you know that actually fiber is very important in our diet? This is because we need fiber to flush out the toxins in our body. And the recommended daily intake will be around 20 to 30 grams a day, which is equivalent to 10 unpeeled apples. Insufficient fiber will cause constipation and in the long term, colon cancer. So psyllium husk is actually an example of plant foods rich in fiber. It is actually very rich in soluble fiber and insoluble fiber. It has 71 grams of soluble fiber in 100 grams of psyllium husk, which is actually 7 times more than oats. So what's the differences between soluble and insoluble fiber? Soluble fiber forms a protective layer in the intestine like a plastic bag to block absorption of fats and calories and cholesterol. It also prevents cardiovascular disease to reduce cholesterol levels, regulate blood sugar levels, and also aid in weight control. What about insoluble fiber? Insoluble fiber acts like a natural laxative, like a broom, to remove the toxins from our intestine to prevent constipation and colorectal cancer. It is once our digestive system is clean, right? We also can have radiant skin as well. So next will be phytochemicals. This is one of the disease-fighting nutrients. So why do we need this? This is to combat our modern diet and lifestyle. As our daily diet, it is difficult to avoid animal protein like meat and seafood, as animal proteins are high in calories and cholesterol, which is not ideal for our body. And negative emotions like stress and anxiety will also cause our body to secrete toxic hormones called corticosteroids, which will suppress our immune system up to 80% within 30 minutes. And if we are facing this daily, this will mean that only 20% of our immune system is functioning. And furthermore, many food actually contains food chemicals like MSG, colorings, and preservatives. This all will affect the normal functioning of our immune system. Therefore, we will need phytochemicals in our diet to combat these problems. So an example of plant food rich in phytochemicals will be cactus. It has over 10,000 types of phytochemicals to strengthen our immune system. It is also a cancer fighter to inhibit tumor formation processes and neutralizing cancer-causing hormones. It has also anti-inflammatory properties to speed up wound healing and decreases cholesterol and triglycerides level. It can also prevent high sugar level by stabilizing our blood sugar. Next will be antioxidants. As free radicals are produced in our body when we are exposed to many pollution like air pollution, toxic fumes, high heat cooking, UV rays, deep fried food, and our own body's metabolic processes. So while I'm talking right now, my body is also producing these free radicals, and these free radicals interfere with the stability of our cell's DNA, causing damage and leading to cancer. Hence, we will need antioxidants to destroy these free radicals. So an example will be rose, which is rich in antioxidants to prevent DNA damage. And I believe that many people would like to look younger than their age, right? And rose has 50 times more vitamin C than lemon, which enhances the body's ability to produce collagen, which in turn also improve our skin texture and appearance, like also lightening pigmentation. Rose also helps to relieve feminine problems like period cramps, irregular menstrual cycle, and also combat colds as well. Another example will be cactus fruit, which has 7 times more antioxidants than vitamin C. It helps to promote cell repair and renewal, improve our skin softness, and also help in wound healing, both inside and on the skin surface. Blueberry is actually also rich in antioxidants to support heart and liver health by reducing the buildup of bad cholesterol, thereby preventing cardiovascular diseases, and inhibit the growth of liver cancer cells by 50%. Blueberry also protect our brain cells, which also can help to improve our memory. And many people now spend long periods of time staring at computer screens and phones, and blueberry actually can help to improve our vision and also preventing urinary tract infection. So the third disease-fighting nutrients will be polysaccharides. So take a look at our environment. We are constantly exposed to radiation from our phones to even TVs. And the constant virus mutation from SARS, H1N1 to now COVID-19. You can see that medical technologies are not able to catch up with the constant virus mutation, right? And lastly, our daily necessity products like our toothpaste, shampoo also contains cancer-causing agents such as SLS, which actually can enter from our skin. Hence, we will need polysaccharides to combat these problems. So example of plant food rich in polysaccharide will be Cordyceps mycelium. It is very rich in polysaccharide. It is also a powerful anti-cancer agent. It helps to regulate immune system, to activate a weak immune system and calm down an autoimmune system. So it may improve both immune and autoimmune disorder. Cordyceps mycelium also helps to strengthen the heart, the lung, the liver, and kidney functions. Also increases energy and vitality, and also increases resistance to stress. Also, a variety of mushrooms like ABM mushroom, maitake mushroom, and shiitake mushroom are also rich in polysaccharides, which enhance the immune function and recharging our immune system. The high amount of polysaccharides aids the production of cancer-fighting cells and suppressing tumor growth, prevents the reproduction, the spread, and relapse of cancer cells. With polysaccharides, it can prevent viruses and harmful agents from entering our tissues. It can also help to treat and prevent AIDS, chronic diseases, obesity, viral infections, help with blood circulation, upset stomach, and also exhaustion. So all elite products are actually formulated wholesome food based on nutritional immunology, where they take further steps into looking into these 6 criteria. So the first one will be type selection, parts extraction, time of harvest, ingredients, nutrients combination, strict and advanced processing techniques, and also safety tests. So all these I will go into details on the next slide. So the first one will be type selection. Nutritional immunologists research on what type of nutrients is good for our immune system. So for Cordyceps mycelium, out of 400 species, only about 10 have nutritional value. It helps to protect the lung and kidney functions, reduces phlegm, cure cough. So the next one will be parts extraction. So they also look into this, which part has the highest nutritional value. So example in cactus, the cactus gel has the highest nutritional value as it has over 10,000 types of phytochemicals. And with cactus, it can help to boost our immune system, prevent cancer. It is also anti-inflammatory to boost wound healing and also neutralize toxic hormones in the body. So for rose, the highest nutritional value will be in its flower, and for ginseng, it is in the roots. So the time of harvest is also important. So the plant is harvested when the nutritional value is the highest. So ginseng, aged around 6 to 8 years old, have the highest level of ginsenoside. which is a type of phytochemicals. It helps the body to adapt to stressful conditions, reduces fatigue, improves memory, and also improves oxygen levels in the body. So for rose, the nutritional value is the highest when it is budding. So nutritional immunology also takes into consideration the ingredients nutrients combination, as the right combination of ingredients can further enhance the benefits of each ingredient and bring synergy, while an incorrect combination will destroy or cancel each other out. So for example, cactus can survive for over 400 years, and the right combination with cactus will accelerate the power of our body cells. So elite products have to go through strict and advanced processing techniques. So example for cactus also, it has to go through high purity filtration to be able to filter very, very small particles such as bacteria that are 0.01 to 100 microns in size. So another one will be spray drying. It is ideal for plants that require certain temperature to eliminate the toxicity. So example with soy actually has mild toxins, and soy requires a heat of about 60 degrees to remove the toxin, the skin, and the seed. So next will be freeze drying. Freeze drying can retain nutrients and maintain wholesomeness quickly. And example with strawberries. So sliced strawberries actually requires around 14 to 16 hours to freeze dry, while a full strawberry takes 3 to 4 days. Freeze drying is the rapidly freeze the plant fruits at the required temperature to remove most of the moisture, retaining about 1% to 4% moisture level. This helps to increase the shelf life without adding preservative, and also quickly reconstitute after adding water. So the last one will be safety test. Many plants actually have been contaminated by the environment, the soil, and the water sources. So being organic doesn't mean that it's safe unless it can pass the following safety tests, like heavy metals, microorganisms, pesticides, and poison tests. We also have a manufacturing facility in Singapore. It is awarded the Food Safety Excellence Award Gold by ABA, where it is graded A for 15 consecutive years. So after sharing on the many benefits of food, the miracle cure is right there in the supermarkets. That is all the fruits and vegetables. So nutritional immunology products are just a convenience to you. So nutritional immunology advocates that prevention is always better than cure. Of course, we need to partner with these 4 factors to achieve a healthy body. That is sufficient sleep, moderate exercise, maintain a positive emotion, and a correct, pure, and well-balanced nutrition to keep our immune system healthy. So through our sharing, I'm sure that now you have a clearer view on the differences between medicines, supplements, and food, and how to choose the correct health food, so that you can share this knowledge with your families and friends. So with this, I will end my sharing over here. So I will pass back the time back to the MC.
Thank you so much. Thank you so much to Melody and Jia En for their sharing. So actually from their sharing, right, I've actually learned from Melody that the side effect of medicine, and also taking supplement also do have side effect. Then for Jia En, right, I actually understand that eating the right nutrients is actually very important. And of course, we must fulfill the other 3 factors, which is on her last slide, which they are number 1, sufficient sleep and rest. Number 2, appropriate exercise. Of course, the last one will be stable mood. So if we can meet the above criteria and couples with the right balanced nutrients, we will certainly get a stronger and healthier immune system. Yeah, really thanks to both of them for sharing. So after hearing from the 2 speakers, yeah, did anyone actually benefited from the product itself? So yes, there is. So for now, right, I would actually like to seek everyone's cooperation by not taking the photos during testimonial sharing, because next up, I will actually invite the sharer. So let me just introduce a little bit about her. So Alicia, right, has a very bad acne problem since her teenage days. So she tried many treatments until she has to go for liver test. So it's like every 6 months because her treatments, right, is too strong for her. So right now, let me invite her to share a testimonial. So let's welcome Alicia.
Hello, my name is Alicia. Okay, firstly, I want to thank my friend Eileen who introduced me nutritional immunology. Nutritional immunology. So this science has changed my health for the better since 2011. Okay, so how has it helped me? I was in a constant battle with skin problems such as acne, pimples, and hives for many years. I was introduced and would visit many beauticians, dermatologists, TCM physicians, medical doctors to manage and prevent my outbreak. So my monthly regime, beauty regime is very busy. I will visit my beautician twice a month, my dermatologist once a month to be injected with steroids because I would definitely have a few fierce acne, and also to replenish the necessary oral medications and the applications to heal my wounds and my scars. So I would also have to undergo a liver test every 6 months to ensure my liver is well before I continue with the prescribed oral medication. So these routines did keep my outbreak in control for a few years until in my late 20s of 2011, I noticed myself to be returning to my physicians, my beauticians, and my dermatologists more often than usual. My outbreak was more frequent till there was insufficient time for my skin to heal before the next outbreak happens. So in summary, my skin was constantly on an outbreak and healing process. So I started to strongly suspect that there was something wrong with my internal body system. For example, I think I have hormonal imbalance issue. Yeah. So in 2011, my good friend Eileen shared with me how she recovered from a chronic stomach condition after consuming nutritional immunology products. She urged me to give the science a chance. I allowed her to share the science behind the products and did my own research to be convinced. So after 6 months of reading and attending Dr. Chan's talk, I realized I could understand my body system better and felt at rest to consume the products for the best doctor in the world is my immune system. So I agreed with my friend that a total overhaul of my body system would be the best way to fight the problem because we cannot isolate any body system to fight the battle. So I chose to consume NI products, nutritional immunology products, called the Complete Complete Nourishment Series as a total overhaul. So I even choose to change my skincare products to alimentate products based on nutritional immunology because I want to ensure that my body system receives the nutrients that is needed to heal during my recovery process, while my system cleanse, defends, and also repair. So as I embark on this total overhaul, I choose to stop all my medical reviews, my medications, and my facials. So after 2 rounds of overhaul for 6 months, I recover well from my recovery process. But my recovery process was not a smooth one. Many times I wanted to return to seek for medical help. But I was reminded that my body system was cleansing out the toxins. My recovery was on the way. So I also received a lot of encouragements from Eileen, who comforted me to be patient with the process as my body's recovery might take longer time to cleanse due to the heavy dosage and my long-term dependency on medications. So apart from consuming NI, I also learned that it's very important to have a good social support to journey the process with me. So maybe I like to share with you some photos of what happened to me during the process. Yeah, okay. Yeah. So as you can see, yeah, the picture on the left is actually the peak of my recovery process. Yeah, during my recovery process, this is the peak. So you can see it was a bad outbreak. I stayed in the toilet for like pretty long, trying every morning, trying to clear whatever that is popping out in pain, and trying to put on as much makeup as I can because I still have to go to work, right? I can't stop. I have to face the public. So yeah, so that was what happened. Yeah, then on the right is my current state. Yeah, after the whole recovery process and over the next few years of recovery. Yeah, so this is my current state. Although the scars are still there, but it's really at the minimal. I think my grateful thing is that, you know, I no longer had to battle with the constant outbreak and dealing with the cycle of, you know, outbreak and healing, wow, and I'm not sure what's happening to my body. Yeah, okay, I think I have another set of pictures. Okay, so yeah, I decided to show this. These are 3 different developmental stage I was in. So the first one you can see, I decided to put my teens photo up because since puberty, I've been battling with this problem. It may seem like a very normal problem, but it really lasted beyond what a normal teens would experience. So as you can see, yeah, the top right-hand corner is when I was about 12 or 13, I don't know, like in my late teens. Yeah, so you can see the pimples popping out. And then on the bottom right, bottom left is actually the second phase of my recovery period. Yeah, so the first one you saw was my peak. This was during my recovery. And the one on the right is my current state. Yeah, the outbreak has stopped. I really felt my body system is really stronger to deal with what's happening in my body. So this is my pictures. Okay, wait. Okay, so after I recovered, I continue to maintain a better immune system by consuming the cleansing and antioxidant products to strengthen my liver and kidney, because I believe they might have been pretty intoxicated from all the years of medications that is suppressing my immune system. So as of today, I continue to consume the NI products. I even feed my family, my immediate family members with it. It's pretty difficult to win NI products off because I have experienced the best outcome. I've gained the relevant knowledge to actually help me choose the most appropriate food to support my immune system. So overall, I really want to thank Dr. Chen for all her work and really her passion to keep her research going and education going so that more people like me could actually benefit from it when medicine has its limits. Yeah, thank you.
Thank you so much. Thank you so much for your sharing. Yeah, so actually, during her sharing, right, I believe she also mentioned about nutritional immunology. So nutritional immunology, right, is actually the science between the nutrients and the immune system. Yeah, so actually, indeed, Alicia has shared, medicine actually can't solve the root of the problem. So we will actually need the right nutrients to boost our own immune system. So, and the 3 major nutrients are actually phytochemical, antioxidant, and polysaccharide. So really congratulations to Alicia for winning back her health. Yeah, so over here, let me share something with you guys. So actually every product is specialized formulated to nourish the overall body, including our own immune system. However, our products are not in any way a form of medication or drug and should not be used to treat or cure illnesses. Yeah, so next up, we will actually start our Q&A session. So I'm sure some of you have already some doubts or questions that you all would like to ask. So we actually open up some times for the questions to roll in. So we will try our best to answer everyone's question. So as I also shared just now earlier, if you're not comfortable to on your mic, you can also use this chat box in the Zoom itself. So let me also just look at the chat if there's any questions, yeah? Okay. Yes, I see one question's coming. So it says that since medicines are not good for us, does it mean that we can just consume fruits and vegetables and don't need doctors? Yeah, so this will be our first questions for today. So who can actually help to answer this question?
Hello, Dawn. Melody here. So let me take on her question.
Okay. so much.
Yeah, sure. Okay, so let me repeat the questions again. So we have this friend, she's asking, since medicines are not good for us, does it mean that we can simply just consume fruits and vegetables and that we do not need doctor? Right, so before I go on, let me share my screen with you. Okay, so here we go. Right. First of all, right, the role of the doctor and the role of eating the good food nutrients, they actually serve totally different functions and they cannot replace each other. So for medicine, right, if let's say today we are sick, then medicines is being used to control the symptoms, to help us to feel better. And because these medications actually helps to replace the body functions temporarily, right? And in severe cases, if let's say medicine is not really helping, then that's when we might even need to go for like surgical procedures to help us to feel better. So say for example, right, if let's say today I have high blood pressure, if let's say I did eat my hypertension medications, then my high blood would normalize, right? If let's say today I didn't eat my high blood medication, then you will see that the pressure actually goes up again. So you see that, the medications doesn't help to cure the condition at all, the high blood pressure condition at all. And it is only like helping me to control it, provided that I eat it. Right, so and at the same time, we know that all medications, they do come with like side effect, and we have to take it long term some more, right? So medication wise, right, in terms of emergency, yes, we definitely have to take it first, right, to help us to feel better. But if let's say we misuse the medication, then it would potentially take our life away. So let's take a look from another perspective, which is from the perspective of the preventive science. That is to say, if let's say today we were to eat very good fruits and vegetables, that can actually help us to boost our immune system. And another science of nutritional immunology, it looks into the kind of like fruits and vegetables, the nutrients that can directly help to boost the immune system so that we can feel a lot better. And apart from food itself, we also need to look into having like stable emotions. Are we feeling stressed nowadays? Are we feeling happy? Are we doing like exercising moderately? Do we have sufficient rest? And these are also important criteria that we should be looking at when we are talking about a good health. So let's take a look at this chart. So what all these like food nutrients from nutritional immunology products actually do is that they are targeted to feed the cells. We have about like 80 trillion cells in our body, right? So once these 80 trillion cells know how to do this three function, which is to defend against bacteria and viruses, to cleanse away the impurities and toxic, and also to do the necessary repair internally and externally, then yes, we would have a good immune system. And with cells being able to perform all these three tasks, that will mean that our organs will get stronger, our body system will get better, and that will lead to an overall health improvement. So basically, right, if let's say we do have existing condition, then yes, it's necessary for us to take the medications to control the illnesses, and at the same time to also eat the very good food nutrients like what Jan has shared earlier, so that they can actually boost our immune system. So if let's say we are not well, we are sick, such combinations can help us to recover better, to recover faster. And if let's say today not sick at all, that's even better. If let's say we are healthy today, and we leverage on this preventive science, that can actually help us to prevent disease in the long run, right? So hopefully through my sharing, it's helpful to know a bit more, right?
Okay, thank you so much, Melody. Yeah, so I do agree that actually it can't be replaced, that when in times where we will still need to see a doctor. But if let's say we are able to choose, shouldn't we just boost our own immune system? Yeah, because our own immune system is the best doctor in the world, which they can actually do defense, cleanse, and repair. Yeah. So thank you so much. Yeah. So is there any more questions?
Hello. Hi, Dawn. I have one question.
Oh, okay.
Okay, it was mentioned earlier that supplements are actually not good for us, but why is it that the market is still selling them and even doctors are also recommending them for patients?
Okay. Thank you so much. Okay, so maybe may I repeat your question? So you are asking about the supplements, right? They are not good. Just now, yeah, the sharing. So they are not good, but why is it that markets are still selling and doctors also recommend for the patient? Yeah. Okay.
Yes.
So it's actually a very, very good question. Thank you so much for asking. So maybe I can actually take on this question. Yeah, maybe before I answer, let us just watch a video, yeah, by Dr. Yi, and let's see what she has to say about medicine and supplement. Yeah.
Are vitamins and supplements essential and beneficial in long term?
The same thing with vitamins and minerals. You know, you get a lot of vitamins and minerals in your plant foods, in your foods in general. So a lot of people will say, hey, you know, I know this is good for you, and I think it's because of this, so I'm going to take it out and sell it to you in the form of a pill. But there's been a push now among medical professionals to have things like vitamin supplements or mineral supplements be treated as a medication rather than something you can buy over the counter. Because in people who are healthy, in people who have a normal diet, in people who are not malnourished, they don't need these supplements. You know, these supplements should only be administered under supervised conditions for people who are malnourished, for people who do have diseases which affect how they absorb or digest food. Yes, there is a role for vitamin or mineral supplementation there. But for normal, healthy people who don't have these sort of limitations in their diet, they don't need these supplements. And in fact, there's more and more research showing that these vitamin supplements actually bring with it side effects, right? So for example, a lot of people believe that vitamin C can help them prevent a cold or cure them from a cold, when in fact, it does absolutely nothing to help your cold. There's also evidence showing that if you take too much vitamin A, then you can cause liver issues. You know, you can have all sorts of issues from taking all sorts of vitamin supplements, but you'll never hear of, for example, vitamin D can cause fetal defects if you take too much. But you'll never hear a pregnant lady saying that she has problems with her baby because she ate too many vegetables. All right, that's not going to happen. So when it comes to things like vitamins or minerals, it's always very tempting to take the shortcut, to just take a pill instead of eating a wholesome food, because we're busy after all, and it's more convenient and it's easy. But in reality, what we really should be focusing on is our health. No, there is no shortcut to health. And you don't really need there to be either, because it's not hard to eat more plants. It's not hard to eat more vegetables and fruits. So rather than take the easy way out and deal with side effects or even effects that we don't know will be coming, it's much better to just eat something more wholesome and take in what you want plus all the other nutrients that are existing in synergy within the food.
Okay, yeah. So actually for this video, right, after we have watched this video, basically when the key essence from this video that we have to take away are, I think the first thing is people who are actually healthy, actually they don't need supplements at all. So like who? The people who actually have normal diets and the people who are actually not malnourished. Yeah, so the second takeaway that I think Dr. Yi also have mentioned is that consuming of supplements should be under the condition of doctor prescription. So usually for professionals, right, we will only advise people to take in the supplements only when they are actually malnourished or those who have actually health condition. So like they lack of certain nutrients, so they have to consume it by doctors. Yeah. So actually during Dr. Yi sharing, right, we also know that researchers has found out that the vitamins do have side effect, which I think during the sharing just now with Melody, Melody also highlighted this, that even supplements, they do have side effect, not just medication. So in this, right, we actually do not want to actually burden our own body. So therefore, actually, we know that vitamins and minerals is actually a very convenient way, but we actually should choose wholesome plant food instead of form of pills. So in the reality, right, we should actually focus in our health in order to stay healthy. So we shouldn't actually take any shortcuts. So in conclusion, right, we should choose wholesome plant food. So for my personal point of view, if let's say my parents, because they are old in age and they are lack of protein and they need to have proteins, so I will encourage them to take a wholesome soy instead of supplement. So as a customer, right, we actually have the right to choose what is best for our own family members. So I hope that I've answered your questions.
Yes, thank you.
Thank you so much. So let me just see if there's any more questions coming up now. Okay, I see one question here. Okay, since you say that the product are just a convenient, I can just buy all the fruits and vegetables from the supermarket instead of buying elite product to consume. I think this is also another very good question that I think a lot of us will face it. So let me just check. Anybody, are you all able to take in this question?
Hello, Dawn. How about let me answer this question?
Okay, thank you so much, Jian.
Okay, thank you for this question. I used to have the same question before knowing nutritional immunology. In fact, nutritional immunologists did mention that our daily diet should include a variety of fruits and vegetables. So hold on a while I share my screen. So let us take a look at what's the differences between nutrition and nutritional immunology. So according to research, we are not lacking in basic nutrients such as proteins, carbohydrates, vitamins, fats, and minerals. All these we can get it in the market, or we can get it during our daily meals. These are nutrients essential for our survival. However, nutritional immunology advocates on consuming the three major nutrients: phytochemicals, antioxidants, and polysaccharides. These are the nutrients for boosting our immune system to fight against diseases and maintain longevity. And there are actually some unique and precious ingredients that are actually quite hard to find in the supermarket. So example like the huge cactus which survive in the desert, the cactus fruit, and even rosebud. And besides that, nutritional immunology also takes further steps into conducting the following on type selection, parts extraction, time of harvest, the nutrients combination, and also the strict and advanced processing techniques and safety tests. So example of a few strict advanced processing techniques will be high purity filtration to be able to filter out very, very small particles, even bacteria. Spray drying, it is for plants like soy that require certain temperature to eliminate the toxicity while preserving the taste, color, and nutrients. And also freeze drying to retain the nutrients and maintain wholesomeness by rapidly freezing the plant food. So all products need to go through advanced processing techniques to ensure that the plant food are safe and the most nutritious for our immune system. And on the other hand, the immune system is very complicated as the human body has 80 trillion of cells and 9 major systems. Research have shown that we should consume more than 15 types of fruits and vegetables in a variety of colors. The World Health Organization recommends a minimum daily intake of 400 grams of fruits and vegetables. This is actually quite hard to achieve on a daily basis. I myself find it quite hard too. Hence, elite products provides a convenience for everyone. So I hope that I have answered this question.
Yes, thank you so much, Tia. Yeah, thank you so much for sharing. I think this question actually relates to me also last time, where I also feel that I don't really need to buy elite product. But actually, is it enough that every day we have enough this kind of nutrient to boost our own immune system, where our immune system is so complex and there's 80 trillion cells? Yeah, so because elite product are really just a convenient food. Yes. All right. So just let me just check again the chat box if there's any more questions. Okay. So if there's no more question, then we'll end our Q&A session. So thank you so much for all the questions coming in. I think we really learned a lot. Yeah. So right now, right, let me share some activity updates. So I think I really want to emphasize this session, even though this session was actually conducted yesterday, it was a live session with Dr. Yi. So why did I say that I want to actually share? Because some of the question that was just asked earlier just now, Dr. Yi also have actually answered herself yesterday during the YouTube live. So the good news is that the YouTube link will be closed by tomorrow morning, 9 a.m. So for those who have not actually watched this YouTube and hear from Dr. Yi, right, please get the link from your friend. Because personally, I've actually watched also yesterday, but I will be rewatching it with my family later. So the next activity will be actually tonight. We will have a Mandarin session via Zoom, and the topic is related to cancer. So how much do you know about cancer prevention? So this event will actually starts at 8 p.m. today. So next, we will have a webinar activity on the upcoming Wednesday, 24th of June, from 8 p.m. onwards. So first session will be actually OPP, and from 9 p.m. onwards, we will have EVG Global Network training session. So just take note that the session will be conducted in Mandarin for this. Yeah, tonight's session will also be conducted in Mandarin. So so basically for this webinar, right, it will needs to be registered via email. So upcoming next, right, there will be a session for career sharing. This will actually falls on the 26th of June, Friday at 8 p.m. This will be via invitation. So for more information about this event, right, you can actually check with the person who invite you today for the Zoom. So the following Monday, which is on the 29th of June, 8:30 p.m., there's an elite global business opportunity which will be conducted in Mandarin itself. So the link will actually open at 8:20 p.m. So for the above session, right, you can actually get the link from your friend who invited you today. Yeah, and of course, last but not least, I think this is another event that I really want to promote. So it is actually our EVG Global Network International New Distribution Seminar. So this will happen in July 5th. So it is a Sunday from 2 p.m. to 5 p.m. So same thing, for more information, right, kindly seek advice from the friend who invite you today. And really last but not least, it will be actually the Elite Global this promotion event for this month. So for Soy Pro, this is actually a brand new Soy Pro which has more soy, more ginseng. It have no artificial flavoring and no fructose. So it has the same great taste. So just to let everyone know that this promotion only falls this month, and it will be, you know, one set of Soy Pro, meaning 2 Soy Pro, you will have a 10% discount. Yeah, so please get this opportunity. I think soy is a very good wholesome plant that can enrich us with a lot of good proteins. Yeah, so so actually we have come to the end of our sessions today. So